Hey, it's Jessica DeMasso with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation. And today we're here at ATA 2020, and I'm catching up with Lee Shapiro, who oddly enough I have never interviewed. Oh my God, Lee, how are you?
It is so great to see you, Jess, and I can't believe we haven't done this before. This is the beginning of something that's going to be wonderful.
I'm hoping that now I get to interview Lee instead every quarter for like the next 5 years instead of Glen Tullman. But Lee Shapiro, you guys know, is 7WireVentures, co-founder, managing partner, and so we're going to pick his brain about all things that are happening in the investment space when it comes to health tech. So Lee, talk to me. I mean, 7Wire been around for a while, had some bets that they placed that have paid off really well. Livongo, company you used to be the CFO of. I mean, so what do you have your eye on now that you're focused full-time on 7Wire? How has the pandemic changed your investment thesis?
We're so fortunate that we've been able to be in this market before it was even called digital health. Our whole idea has been trying to find ways that we can address the challenges we all face as consumers of healthcare. And Glenn and I started investing 25 plus years ago with this idea that you could use technology to solve broken business process. Well, as you've learned through WTF Health, there's enough broken business process in healthcare to last a lifetime. And so we're trying to find ways to help all of us address what we need as consumers of healthcare, not as patients. We all want to be healthy. No one wants to volunteer to be a patient today. We're looking at ways that we can improve our health. And our focus has been using some of the platforms that exist in terms of being able to extend our reach. So the pandemic really accelerated a lot of what we had been seeing in the market because we realized that health has to meet us where we are. And that meant at home for the last 2 years. But it also can mean when we're traveling, when we're in the office. How do we bring health to people and allow them to do the things they want, which is not to have a disease, to put that in the background and to really live their lives in the way that they hope to with their families, with their friends, and to be activated in terms of managing that health. So that's what we look for.
All right. Any particular areas of focus? I know mental health has been really hot. I know you guys have some portfolio companies that are in that space. You know, health equity is really grown in importance, especially over the last 2 years, as people have become more mindful of, you know, that not all care is distributed equally. Like, what do you have your eye on right now?
So keeping with that theme of care in the home, we have a wonderful company that we invested in called MedArrive that's doing great work. In fact, Inna Plum is going to be on my panel here coming up shortly at ATA, so a plug for MedArrive. But allowing individuals who have challenges accessing healthcare to get their vaccinations at home, to have home visits, to keep those homes safe, to allow them to get wound care, to be able to provide them with medication therapy management, but using resources that are available that aren't fully taken advantage of in healthcare today. You mentioned mental health. We have two great companies in that space, NOCD, that's been helping people with severe anxiety and depression, Brightline Health, which is helping families manage the needs of their children. And it's when the child has a challenge, the family has a challenge. And so we work on that as well. We see a lot of benefit that is available in the market now to serve those individuals who are now part of the silver tsunami, 10,000 people aging every day into Medicare. And we have a company called Home Thrive that's helping seniors live at home independently. No one really wants to put their loved ones into congregate care in light of the pandemic. So how do we bring health to them and allow them to do that in a way that makes it easier for the caregiver as well as for the senior to access health? So this is a very target-rich environment, Jess, and wonderful companies. I could probably talk about all 20 of them in a portfolio if we had enough time.
Well, all right, high level me then on this. You know, we're hearing a lot about the digital health tech investment market, both publicly and privately. What are you seeing there? Are you seeing valuations start to correct right now? I feel like that's the word on the street that I'm getting, but I'd like to rumor check that with you.
So public market valuations are what they are at any given point in time. It's what a buyer is willing to pay for a share. And certainly there was a sense that valuations were high in the marketplace. We think that good companies are always going to be able to raise money because they're doing good things, they have recurring revenue models, and they'll continue to raise throughout the course of this correction. The private market hasn't fully corrected yet, but it's just, I never learned in school like how you value companies based on multiples of revenue. It has to be based on like earnings and earnings potential and profitability. And so we invest in seed and Series A companies So we bet for the long haul, but our idea is always to build a company that's going to be one that can be a great company and that's going to sustain itself over a long period of time. And I think that the market will correct itself. Maybe we've overcorrected a little bit too much and penalized some companies in the public sector, but valuations have a way of regressing to the mean over time. And we're in a period right now where I think we're going to get back to something that we saw in the last 6-7 years, but not in the last 2 or 3.
Okay, no, that makes sense to me. I like that. I like that take. Thank you. All right, I wanted to ask about scaling too, because like you had mentioned, you guys invest in early stage Series A companies, and it's like I'm watching right now one of your other portfolio companies, Glen's company, Transcarent, how he's kind of following the same playbook that you guys ran at Livongo. So it's like raise a bunch of money and then acquire a bunch of stuff so that you can, reach that full model faster and build your client base, build those revenues up. So is that the right way for a digital health company to scale, or like what are your thoughts on that?
So part of the playbook, and not only true for Transcarent, where Glen's done a terrific job, but we saw it at Livongo.
Did he pay you to say that, Lee?
Absolutely. But what we have is a team there that's built for scale. Wonderful team members that are able to take the company to the next level. And whether that's Snezana Mahone, or whether it's Stephanie Peng, our CFO, or the team that's leading sales, like we have people throughout the organization that are really able to help the company achieve great things. We've used that same pattern with other companies in the portfolio. Go out and hire a great team, and once you have that team in place, not only are they going to be able to better serve the customers, but they're also going to be able to help you do the things that you need to do to train the next generation of leaders. Okay. And that's how the company perpetuates itself. So I think the team is probably the most critical element in terms of scaling a great business. And the second element is being able to listen to your customers and adapt to the marketplace.
All right, one quick customer question for you. I feel like lately, like the last 6-8 months, I've been seeing a lot of, or hearing a lot of chatter about payment model, and more so than I think I ever have before. And like in the sense where it's just like before, it was like you couldn't talk about the payment model. It was immutable. It was unchangeable. You couldn't do it. Now we're even seeing like Transcarent, different way of paying for care, putting the employer in charge, eliminating middlemen. We're seeing next gen PBMs emerge. We're seeing, build your own health plan technology companies invested in by like legit health plans. Like, it's interesting what's going on out there. Are you picking this up too? And do you think that we're in like the middle of maybe the start of a payment model revolution?
Innovation is like water. It flows to where there are opportunities. And in this payment model change that we're witnessing right now, it's because some of the old models didn't align incentives the right way. Right. So when you think about what employers used to do for buying benefits, they were paying per employee per month, whether someone used something or not. Right. And employers have woken up and said, we'll pay you, but we'll pay you a little bit more for people who are activated and engaged, because that's where the value is going to come to us. And I think health plans are starting to understand that as well with their move to more value-based care, but sharing risk in those models. What Transcarent is doing is ingenious because they're looking at third-party benefit administrators and healthcare navigators who have basically said, the more you spend, the more we make. Well, how does that work for a health plan or for a self-insured employer? You need to align interests and say, when we're directing people to the right kind of care, we're going to keep them healthier, we're going to reduce your costs, and everybody should win.
And eliminating that middleman, like how possible is that, you think, for some of these startups? Because I mean, that's always been the situation, the David versus Goliath of like, well, how are we possibly going to do that?
We've started to see a fragmentation, disintermediation of a number of the middlemen. You mentioned next generation PBMs, and we're excited about Mark Thier's company, Waltz Health, because they're looking at ways to try and deliver better value to consumers, to inform them about ways in which they can get better pricing for medications, and taking some of the administrative costs that adds anywhere from 12 to 18% of pharmacy benefit managers and removing that from the equation so that consumers benefit.
Yeah, that admin cost, it'll kill you every time. And all along the food chain in healthcare, right?
We see it everywhere. And there's where opportunities arise is to find ways to carve that back and to be able to deliver better value to the buyer.
All right, Lee. Well, thank you so much for stopping by to check in with us. I love hearing your take on the market. A very well-informed take, maybe a better take even than Glen Tullman's take on the market. I'm going to start some trouble.
I taught him everything he knows.
That's it. We heard it here, you guys. All right, Lee, thank you so much. Thank you so much. It's a pleasure to speak with you. I'm Jessica DeMassa, and for more interviews with the who's who of health tech as they change the way that we do healthcare, check out my YouTube channel over there at youtube.com/WTF Health. Thanks again.
Thanks, Jess.